what is DDH? So DDH happens when a baby's hip joint doesn't form in the right way. In a healthy hip, the ball at the top of the thigh bone fits neatly into the socket. So this is the ball and this is the socket, and it should fit right in. But in DDH, the socket may be too shallow, too loose, or the ball may even slide out, or just slide in and out, or be completely out of the joint. So this condition can range from the very mild kind to the more severe kind, and it can affect one or both hips. What causes DDH? We don't always know why DDH happens, but here are some of the common factors. One is the hip may develop abnormally in the womb. Two, it could be because of the hormones from the mother that can make the baby's joint very flexible and therefore at risk of laxity around the joints. Family history does play a role under the risk factors for DDH. And yeah, it can run in families. So what are some of the risk factors of DDH? So some babies have a higher risk of DDH, and here is what to look out for. It's more common in firstborn babies, and this is because the uterus is still quite tight with less room to move around. It's more common in girls. It's mostly seen in DDH is seen more in girls than in boys. It's also common if there's a family history of hip problems in the family. We also seem to see more DDH in children who are in a breech presentation in the womb. That is, the kids are sitting, or it's the legs first instead of the head first. It's also seen in cultures where they do swaddling, meaning the legs are placed together and wrapped instead of having them not wrapped together. So all newborns are checked for DDH before they even leave the hospital. A doctor gently moves the hips of the baby around to feel if they're stable, and if there are any concerns or if there's a risk factor present, an ultrasound or an x-ray can be done. Typically hip ultrasounds are done because the baby's hips won't show well in the x-ray. The earlier we catch DDH, the better the outcome, so regular baby checks are very important. How do we treat DDH? So the treatment depends on the baby's age and how severe the dysplasia is. So, as we mentioned, the treatment based on age. For babies under 6 months, a pelvic harness is used to gently hold the hips in the correct position so the hips can grow normally. For children between 6 months to 2 years, the hip doesn't stay in place, so doctors may do a close reduction, which requires gently guiding the hip back where it should be, and then under anesthesia, place them into a spica cast. In children over 2 years, or in severe cases, surgery may be needed to reshape that hip joint and the bones for better alignment. So most treatments work really well when started early, and most children grow up to walk fine, run just fine, and play just like any other kids. What is the prognosis for DDH? So with early diagnosis and treatment, the outlook is excellent. Most children recover fully and don't need any further intervention. But follow-up is key. Your child may need regular x-rays as they grow to make sure that these hips are actually staying healthy. So if DDH isn't treated, the child may develop a limp, or there could be a limb length discrepancy. They could have hip pain. They're at a higher risk of getting hip arthritis at an earlier age than the normal population. They could have reduced mobility or need a hip replacement surgery earlier than what's expected. If a dislocated hip is never caught or corrected, the body may adapt, but not in a very good way. So the hip socket won't grow normally, leading to damage and maybe limited function. And that's why early treatment is so important. So here are a few quick recaps for parents. One is that DDH is a problem with how the hip forms, how the hip joint forms, particularly the socket. It's more common in girls, in children with breech presentation, and in firstborns. The early diagnosis is key, and the ultrasounds helps us confirm this. Treatment may include things like use of a harness, a cast, or even using surgery. But with care, and particularly if this is picked up early, most children do really well. So if your child has been diagnosed with DDH, take a deep breath. You're not alone in this. It's actually a relatively common condition, and the help is available. So with early treatment and follow-up, your child has a very strong chance of a full active life. So thank you for watching this video today. And if you found this video helpful, don't forget to give it a thumbs up. Don't forget to subscribe, and until next time, keep it a little growing bones.